Michelle again. I'm having a pretty good day today. I've even put makeup on. Today I want to talk about my diagnosis. And the reason I want to talk about my diagnosis is I feel like it'll help me to express myself and work through it. It's a little traumatic, and to maybe touch others and help them with things they may be struggling with or have been misdiagnosed in the past. I was a sick girl for quite a lot of 2015. And prior to that, I had been sick periodically with different stomach and gastric stuff that I had gone to the doctors for. My path along diagnosis was not easy. I was in my late 30s, early 30s actually, when it started, my stomach problems. And I started going to the doctor complaining about digestive issues. I'm not going to get into the poop subject, but it is all about poop. Neuroendocrine cancer is sometimes all about poop. That's all we talk about. So be forewarned. But for me, I was having a lot of struggles with my menstrual cycles. They just disappeared. I was having symptoms of menopause at a very early age. Doctors rolled their eyes at me, said, well, that's just weird, and didn't really further go into it. I had digestive problems that were going on simultaneously, where I wouldn't go to the bathroom for like a week and a half, 2 weeks, and I was struggling. I was drinking water, I was exercising, I was eating healthy. For no reason, doctor would be like, just eat a bag of prunes, and didn't help. Like, it was just horrible. And I say he because there's one doctor in particular that I think traumatized me. He told me it was psychosomatic, that it was mind over matter, and that I was choosing to not be able to go to the bathroom. And I'm trying to saw this because, oh my goodness, I'm so angry about that still. So I went back to the doctor periodically through the years, oftentimes waiting a long time in between and just going, suffering with it because I didn't really feel heard, and I thought maybe I was crazy. I'm not going to go all into this, but my own mother had a problem with prescription drugs and often faked illnesses, sadly, to get pills. She was a good woman, but had some struggles. And so I sort of started to think, oh my gosh, is that what you're doing? You're just assuming faking this illness, and stop it. Just put it away. So I tried to go on with life, raise my children, and was strong through that. And then my 40s came, and I really started to feel crappy. And I was really a health nut right then, because I was 40 pounds overweight in my late 30s, and decided that I was going to lose 40 pounds a healthy way by turning 40. So I changed my diet, I exercised every single day, and I was able to lose the 40 pounds. So going into year 42, which is the year I was diagnosed with cancer, I weighed 130 pounds, and I was probably in the best shape of my life, but I didn't feel good. I was having stomach problems. Oftentimes I was just sick for a whole day and didn't know why. I just didn't feel good. I went to the doctor. They said, oh, it's not a big deal. You just have irritable bowel syndrome. They did a colonoscopy. It's irritable bowel syndrome. You don't have any problems. And continued to tell me just to eat prunes. And I just wasn't feeling good. I had this gnawing pain I complained about. They told me it was costochondritis, which is like chest wall pain. And I was like, no, that's not it. I knew in my gut, in my heart, something wasn't right. But they're doctors, and they're supposed to know, right? And I believed that it was in my head, and I was making more of it than it was, and just, shut up, Michelle, go on. Well, in November, had the job of my dreams. I was going places, doing things that I loved, and feeling really strong about things. And I went to a conference that was out of state and got ill while I was there. Came home, wasn't feeling good, called my best friend, told her that I was sick, I wasn't feeling good, I wasn't going to work, which wasn't like me. And I drove myself to the emergency room And I went in, they saw me quickly, did tests, did blood work, and told me, we think you have an ulcer. It was a Friday. Go home and follow up with your doctor. I said, all right. I had a hair appointment that afternoon, so I was like, I'm gonna try. They gave me this like pink Pepsid stuff to drink, and it kind of made me feel better. So I drove out to my hair appointment. In the middle of my hair appointment, I started feeling cruddy, and my hairdresser knew it. And on my way home, I called my best friend again and said, nope, I am going back to the hospital. Can you go with me? And she said yes, frustrated because she didn't really want me to go to the hospital I went to, but it was the one I could drive to, and they had seen me earlier, so I just felt like I needed to go back because the pain was getting worse. And they made me wait 4.5 hours almost in the waiting room, thinking that I was just there to get pain meds. And finally, I was seen, and the doctor asked, it was a new doctor on call in the emergency room, and he asked me why, what was the reason I was let go home, because they found something wrong in my blood work. And they told me that I was in the midst of pancreatitis, acute pancreatitis, and that I needed to be put, they needed to sedate me and let my body do the healing, restrict all food and liquids by mouth, nothing by mouth for a few days to let my body heal. They called it alcoholic pancreatitis because at my age, I didn't have any other health issues, so they didn't think it was anything else. They assumed it was just me being a partier and called it alcoholic pancreatitis. So this, I was admitted that night. They let me go home. The lab work had already been done, mind you, that same day. And they let me go home. They missed it on my lab work. And when I got back to the hospital, the doctor pulled up my lab work and saw that I was in this crisis. So it was an emergency, and they sedated me for a few days. I don't remember much. I did do a lot of weird talking, apparently, my best friend told me. And they did some tests. They did ultrasounds, they did CT scans, and then finally an MRI. And I remember being in the ER before they sedated me, asking, is it cancer? And they said, why would you think that? You're 42 years old and you're healthy. It's not cancer, you just drank too much. And I'd been socially drinking, so I thought, maybe it's my fault this has happened, I don't know. So they put me to sleep, let me be sedated. Pain started subsiding. And on like the third day, the doctor came into my room, and same doctor that I asked if I had cancer, and said, why would you ask if you had cancer? And I said, I don't know, it's just a feeling I have. And he said, well, we found a mass on your pancreas. Long story short, I was diagnosed with a mass. They wouldn't tell me what kind, and I went home from the hospital. That was on November, I'm sorry, I have to look at my notes. November 24th, I went home, right before Thanksgiving. I wasn't seen for my biopsy until December 10th. I was diagnosed over the phone with neuroendocrine cancer on December 22nd. 2 whole months after my original going to emergency, on January 20th, I was seen at Stanford for my oncology and surgeon consult. And on February 1st, I underwent major surgery called a Whipple procedure and had the tumor removed. Getting to the points that I wanted to make, besides telling my story of diagnosis, I wanted to really point out that I think what I learned is that you always have to listen to your body. Always. It's this weird feeling that you just know something isn't right. And the doctors are telling you that it is okay, but you just know something isn't right. Listen to that. Push forward. If you have to get 3, 4 opinions, do it. It's worth it. This tumor was not young. My surgeon told me it's been there a while. This has been growing. It's a slow growing tumor, but it is been there a while. It's made it a home there, and now it's causing havoc. So I suggest and I ask you and beg you to push forward. If you don't feel confident in the first answer you get, push forward and get another one. Advocate for yourself. I know it's hard. Some people don't think that. My grandfather was somebody who didn't question doctors. It's not something that you're supposed to do. The doctor knows. You know, he didn't like that I came in and questioned doctors on his behalf. And he used to scold me for that. But I believe that we have to advocate for ourselves. And we can do that in a way where we're not being rude or making a doctor feel like we're questioning their profession. They know a lot. They go to school for this. We should respect that. But at the same time, there are things that are overlooked all the time. And so we need to advocate for ourselves because it's very important. And if we can't do it, let's bring someone with us. Ask someone to be your support person. I had a great support person. Kayla was with me through thick and thin. And I don't know what I would have done if I didn't have that in her. She was a rock through it all. She scribed every single time we went to an appointment. She took notes for me. Because when you walk out, you don't remember anything. So, let me just say one more time. It doesn't matter if it's neuroendocrine cancer or if it is a tooth that doesn't feel good and you know something's going on. If you know that your body has something going on, trust it. Follow through. Advocate for yourself. I'm living proof of this. And never give up because you are important. And I just wanted to pass that on. Hopefully it helps somebody. Maybe you've had a similar story. You're not alone. And I know I'm not alone. This has happened to many people I know, especially with neuroendocrine cancers, all the people I've met. It's a hard thing, and it's silent, and it mimics other problems that are a little bit more common. So please don't give up. Please fight the fight. Never ever give up, as someone very wise to me taught me. Negu. Okay, well, that's it for today. It was a long message, I'm sorry. But actually, I'm not sorry. So I had a lot to say, and I hope you have a blessed day and stay peaceful, and I love you. All right, till next time. See you later.